Into a hospital with little comes a frantic request to share more.
Yes, but in the pharmacy there is no bandage and like alcohol, and we need a lot of supplies we want to take to the train.
Israeli medics already out of the 300 kilos of supplies they brought to Ukraine.
You need the blood?
No blood. If there is someone that not drink and need to
you need spiritus?
Yes. Saline, spray, alcohol.
They say they've all but cleaned out pharmacies, but there's nothing here to spare. Of course not. Look at the nurses a few floors up, making do, exhausted adults dedicated to kids. This hospital in Lviv is primarily a children's cancer center. It's now overwhelmed. Most seriously ill kids are moved by train away from areas of heaviest bombardments, ideally out of Ukraine, but increasingly they end up in Lviv and in the care of a spent and furious head of pediatric oncology.
It is a mess, and I think most of them will become indirect victims of this Russian army attack, because they will die because of this interruption of treatment, because of infections, and we can do nothing now.
Trains to buses arriving daily, doctors resorting to carrying the kids in, triple the number of patients typically here.
It looks like a war hospital, not a cancer hospital now.
It also looks like love at work. A family from Kyiv staying here while 12-year-old Anna undergoes treatment. A young model and dancer with big dreams.
I see your beautiful eyes in here. Very nice.
Thank you.
But first she must finish treatment, then they need help getting to Poland.
What is your big hope for you?
The biggest my hope to go back to home and everybody was alive and healthy.
All anyone wants, but it's frightening. The hospital's windows taped against blasts. The bunker ready for kids, sometimes full of them, but that's not always possible.
It's very, very difficult because of when children are connected to the machine. We can't interrupt the processes of hemodialysis, and we can't immediately return the blood to the body of patient. So we close all windows, we close all doors, and we stay here with our patient.
That means waiting it out in the dialysis room, sealed up windows, machines whirring, little souls needing them to hold it together.